Kay here, speech and language pathologist from Chatterbox Speech Pathology. So I've got a little rant. As a parent and as a speech and language pathologist, trust your instincts. If you have a concern for your child's speech or language development, trust your instinct, okay? Now, the reason I say that is research has just recently been released, and in that research, it looked at parents' identification of their child's speech sound development and early childhood teachers' identification of a child's speech sound development. And what it found is that a third of early childhood teachers are likely to neglect observing any difficulties. What they found is that 88% of parents were likely to be accurate in their identification, while only 71% of early childhood teachers were accurate. Now, this is not anything to go against early childhood teachers, because they are fabulous at what they do. In fact, hats off to them, because I think it must be extremely challenging to be in a room with lots of little people all wanting your attention while you're trying to follow their lead and follow their interests. But what I am saying is, as a parent, if you have concerns about your child's speech sound development, how often do you maybe speak to your wife or your husband or your mother or your mother-in-law or your best friend or social media on Facebook group? Now, how often do you do that first before you actually speak to the speech and language pathologist, the person who has knowledge in this area, who has gone on to have tertiary education in relation to this topic? So, what I'm going to say is, this research backs up that you guys as parents are normally spot on. So trust your instinct. If you have a concern for your child's speech sound development or language development, speak to the speech and language pathologist. Ring them, ring us, and find out whether you should book in for an assessment or not. Now, when it comes to speech sound development, you want to do something about it sooner rather than later. And sooner is in those early childhood years, those preschool years. Because once children start school, going into school with a speech sound disorder or difficulty is more likely to impact on two things. One, academically, or two, socially. Now, it can impact on a child academically because we know there's really close links between speech sound development and literacy development. When a child starts kindergarten, they're learning how to read. And if they're not producing their speech sounds at the level that they should for their age, then that can impact on their ability to sound out words, to physically say a sound, or to manipulate sounds in their mind. So it can really impact academically on that way to learn to read. It can also impact socially because, well, others might not be able to understand them, which means they're more at risk of being picked on or being isolated from their peers. So I want you to think about it. If you're talking to someone who has a really heavy accent, you probably find it hard to listen to them. It's draining, it's exhausting, and you decide, I really can't be bothered listening to them, even if what they've got to say is really interesting. You've got to be super duper motivated. It's the same for children at school. If your child's having difficulties with speech sounds, it's almost like they've got a little accent from a child's perspective, which means it's harder for them to understand your child, which means it's more effortful, which means they're more likely just to walk away. It's not about them being mean. They're just going to go to someone who they can more likely understand better. So, what I can say to you, if you've got a concern for your child's speech sound development, trust your instinct, see a speech pathologist. Don't wait, do something sooner rather than later. If you found that helpful, then share it with a friend and help your friends so that they know, see a speech pathologist sooner rather than later. Thanks, guys.